Hello, my dear friends. Dr. Dhawan here, your ENT faculty. We are starting this YouTube live session in a minute. Please inform your friends and your colleagues who are appearing uh, on 26 July 2025 FMG examination. जो लोग 26 जुलाई को एग्जाम दे रहे हैं उनके लिए ये सेशन प्लान किया गया है. काइंडली इन्फॉर्म देम. अपने सारे फ्रेंड्स को एक बार इन्फॉर्म कर दो ताकि हम एक बार प्रॉपरली स्टार्ट कर पाए. इट विल बी अ क्विक सेशन, नॉट टू लॉन्ग, बट विल कीप इट हाई यील्ड एंड अप टू द पॉइंट सेशन. आई रिक्वेस्ट एवरीवन टू प्लीज इन्फॉर्म योर फ्रेंड्स ऑल्सो. जो भी लोग प्रिपेयर कर रहे हैं इस एग्जाम के लिए जो 2025-26 जुलाई को है उसके लिए एग्जाम. If you are on the chat, please tell me everything. Audio, video, okay? Audio, video is okay, everybody? Yeah, I think that's fine. That's fine. Okay. So, welcome to session, and I thank Bright Medico Makers to arrange this YouTube live for you guys. And guys, let me tell you कि अगर मैं एग्जाम दे रहा होता, अगर मेरा एग्जाम होता 26 जुलाई को और मैं क्या करता आने वाले जो 45 डेज लेफ्ट है कि पास होने की चांसेस बढ़ जाते हैं. नंबर वन मोस्ट इंपॉर्टेंट थिंग जो मैं कहना चाहूंगा वो ये है कि इस समय अगर हम टाइम वेस्ट करेंगे तो काफी चीजें छूट जाएंगी. बिकॉज आपने जो मार्च में पढ़ा, अप्रैल में पढ़ा, अगर आपने अभी रिवाइज नहीं किया तो दिमाग में नहीं होगा. तो ये वो टाइम है जो मैक्सिमम पढ़ने का टाइम होता है. एक्चुअली बहुत सारे लोग ये गलती करते हैं कि सेकंड पार्ट में आके थोड़ा स्लो डाउन हो जाते हैं. आई थिंक अगर हम मिलके काम करें और समझदारी से काम करें तो जिन लोगों ने भी नीट, पीजीओ, आईएनएसटीटी, एफएमजी पेपर हो अच्छे नंबरों से पास किया है, उसका एक बहुत बड़ा एक कॉमन फैक्टर होता है कि लोग सेकंड पार्ट में, जब लास्ट वाला पार्ट होता है, ये जो आपके पास लगभग 6 हफ्ते बचे हुए हैं, उसमें ज्यादा पढ़ाई करनी होती है. कितनी पढ़ाई करनी है सर? हाउ मच यू हैव टू स्टडी? द simple litmus test is 7 days में you must study more than 80 hours. I'll say in English, Hindi both. What is the litmus test? Dr. Dhawan, if it would have been your paper, अगर आपका पेपर होता तो कितना पढ़ना सही पढ़ना होता है? कितना पढ़ना मतलब 7 दिन में आपकी पढ़ाई 80 घंटे के ऊपर होनी चाहिए. हर दिन एक जैसा नहीं होता. Every day is not same day. I'm not saying every day you should do this, but everybody who is really sincerely working for the FMGE examination must be studying at least 80 hours in 7 days. That is the litmus test. और मैं बिल्कुल भी फिलॉसफी नहीं झाड़ रहा यहाँ पे. I'm not saying that कि जो चीज पॉसिबल नहीं है मैं वो नहीं बोल. I'm not saying that because when my MRCS exam happened just couple of years back, I was studying 12 to 13 hours every day because medical exams are like that only. इससे कम पढ़ना, slow down हो जाना, believe me, you're inviting problem for yourself. And I'll be really straightforward with you. Because only one wishes, only one prayer is that may you all pass the examination. And मैं साफ साफ बोलना चाहता हूं, आप पास होने के बहुत पास हो. मैं फिर कह रहा हूं, आप पास होने के बहुत ही पास हो. अगर आप अच्छा पढ़ोगे तो और पास चले जाओगे. अगर अभी स्लो डाउन हो जाओगे तो थोड़ा दूरी बढ़ जाएगी पास होने. इन इंग्लिश यू आर वेरी क्लोज टू पासिंग द पेपर. इफ यू विल डू मोर हार्ड वर्क इन दीज डेज you will get even more closer to passing the paper. But if you will waste time, then the distance between you and success will increase. So number one rule is, which will follow in these 45 days, will be we will be more dedicated. We'll be studying 11-12 hours every day. We must be going to the pinnacle of the hard work now. Number two is, now do not gain too much of new knowledge after 25th of June. Enough is enough. जो भी करना है 25th June तक, if you want to gain something new, some subject is pending or whatever is there, 1 month before the examination, we must say goodbye to new things. But make sure in these 15 days, from today to 25th June, you must focus every day for 90 minutes to 2 hours, 1.5 to 2 hours in the morning first time. Please target your weakest subjects. For example, Dr. Dhawan, I'm very scared of CVS from medicine. Or, Dr. Dhawan, I've not done pharmacology properly. I've not done bacteriology from microbiology. For first 2 hours every day, 1.5 to 2 hours every day, keep it for your toughest challenging subjects which you have not done properly till now. पहले 2 घंटे में सिर्फ वो सब्जेक्ट करने हैं सुबह उठते ही, जिनसे बहुत डर लगता है, अभी छोड़ के बैठे हुए हैं और अभी भी पूरा नहीं किया. Till 25th June, you have a time to really do, more knowledge going to your brain. After that, no more knowledge will be really going to your brain. I'm telling you. Then everything is like for revision only. Now, the I'll keep saying the rules actually. First is we'll study more in these remaining 45 days. Number two, first 2 hour every day for the toughest challenging subjects which we are, or topic of the subjects which you have not done properly till now. Number three, every day, 3.5 to 4 hours should be only for MCQ oriented study. If you're only doing theory revision of the notes, it would not really help us reach to the success. I'm telling you very clearly, don't mind it, but this paper is not theoretical paper, it's objective paper. So everyone should be knowing this, that you must make sure that at least 100 questions every day. Let me make it simple. If you are a repeater, you should do 150 question every day. If you are a fresh first timer, you must do 100 question every day. Now, how to do these 100 question? 3.5 to 4 hour every day for MCQ oriented study. Like you're done Gynae properly, obs getting done properly. Rather than revising Gynae notes one more time like this, it would not be a good idea. Let us do like this. Let us do 50 question of Gynae custom module, keeping the level difficult level. All tags to be accepted except INICT. Leave INICT, but include NEET PG, include clinical vignettes, drug of choice, image-based questions, clinical scenario-based question. Let it be a very mixed bag of thing. It will be real kind of paper. And now solve those 50 question in not less than 35 minutes. Everybody, please write it down. Do not do 50 question in 15 minutes or 17 minutes. It's disastrous. This is happening. The biggest reason why people are not passing the paper is that they are doing more silly mistake in the question which they are confident about. जिन टॉपिक में हमें कॉन्फिडेंस है और वही क्वेश्चन हमारे गलत हो रहे ज्यादा. अब देखो जरा ध्यान से, हम क्या हो रहा, जब हम क्यू बैंक करते हैं हम फास्टेस्ट फिंगर फर्स्ट खेल रहे हैं. 17 minutes 50 question done. Same thing you'll do in the exam also. Brain does not know good or bad. Anything done repeatedly become a habit of the brain. Anything done repeatedly become a habit of the brain. If you are doing these 50 question in 15 minutes in these 45 days, on the exam day, you'll also do the same thing. Please put a clock. Do not solve the 50 question in less than 35 minutes. Go beyond 35 minutes. It's a good idea. Make the habit of reading all the 4 choices. However simple the question may be, think about it and then only mark the answer. Now, everyone, after 35 minutes are over, next 1 hour is for the revision of 50 questions now. Some question went wrong, some question you could not recall, some question you could not integrate. Now, 50 questions done in 35 minutes and 1 hour of recall. This is approximately 1.5 hour session. I am keeping 3.5 hour for you. Please take your own time, 50 question block, then 1 hour of revision of those 50 points. 50 question block and 1 hour of revision of those points. This is close to 3.5 hours. And if you are a repeater, do 3 such sets. Do not do 1 question, 1 explanation. That's not, because paper is also like that. 50 question you have to do, and you have to really, do 6 papers of 50 question each. So every time you do MCQ in a day, do 50 question 2 block, but revise all those 50 question points which went wrong, which you could not recall, in 1 hour. If you're a repeater, do 3 such blocks every day. They're very good rules to follow. My dear friends, let me tell you, ये पेपर चाहता है कि तुम पास हो जाओ. Let me tell you, with all, this is my 27th FMG examination. जो मैं 27th टाइम FMG एग्जाम में 7 आपका पार्ट बन रहा हूँगा. एक बात मुझे बहुत ईमानदारी से बोलनी है. One thing I want to tell you very clearly, very honestly, that this exam wants you to pass the exam. The exam structure is like that. 150 out of 300 without negative marking is an absolutely achievable task. 150 out of 300 without negative marking is an absolutely achievable task, provided you spend these 45 days properly. The final decision lies with the Almighty. With the blessing of parents, and Almighty will pass exam. But it's not NEET PG, it's not INICT where the cutthroat competition is there. This is a threshold passing examination. Dr. Dhawan, why we are not passing exam? Number one reason is people are doing less questions. Number two, people are doing questions, they're doing mostly PYQs only. You have to go beyond PYQs for sure. Number three, people are running away from grand test. How many grand tests, Dr. Dhawan, shall I do in these 45 days? Preferably five, minimum four. It should be more than four. Every 10 days, keep 1 day for grand test. But when you do grand test, create the simulated environment in which you do the real paper. And in the evening, 6 hours are required to review these 300 questions. A grand test day is a grand test day. You can't do grand test in the morning and you study medicine in the evening. Not at all possible. Not at all possible. A grand test day should be purely grand test day, starting with the grand test, ending with the grand test review. You will have to do the full day grand test, then 1 hour of break, then 6 hours you will require for reviewing the questions actually. Otherwise, the grand test become a source of depression. Guys, if it's not a time to read only theory and theory and theory, that would not be the right path, I'm telling you. So again, I repeat, till now what we have covered, let me tell you, take home points. Not, I don't want to waste your time. Number one, we can pass this exam. Number two, this exam wants you to pass the exam actually. Number three, हम pass होने के बहुत ही pass हैं. Number four, if we are more dedicated, we can extract at least 80-hour output out of 7 days. Then you will be getting opportunity to see lot of data. Don't revise slow. Don't take too much time to revise the content. Revise with focus but faster. It's not a theory writing competition. Peutz-Jeghers syndrome. You have to. The name is written over there. You know the name is written Peutz-Jeghers over there. You have to tell which of the following is not the clinical manifestation of Peutz-Jeghers syndrome. So for that, you just review the data, remind your mind one time, go faster. When the MCQ comes, you revise Peutz-Jeghers one more time over there. Guys, reading slow or reading fast, speed of forgetting is same. You revise slow or you revise fast, the speed of forgetting is same. Multiple revision are better. So I'm giving you a target. Till 15th July, you should be reviewing the content 2 more times, little faster. But little faster and focus. Don't waste too much time on story building pages. Go to the ulcerative colitis versus Crohn's disease page. Go to the Burns formula faster. Go to the main point of sigmoid volvulus. Go to the main point of intersusception. How does it present? How does it, how do we diagnose it? And what's the surgical management for it? Go to the exact, breast cancer staging and its management. Similarly, orthopedic, tumors are there. You should know the 5-6 main tumor. What is the classical appearance over there? And review them and go. Don't read nitties and gritties now. It's not time. Guys, it's pyramidal approach. You've done the classes one time you revise after classes. Now you should go more high yield. Like, sun ray appearance is coming. The classification of, Garden classification of fracture of femur neck. You should be knowing Salter high risk, the fracture classification. But these are things you should be revising actually. Rather than just revising the weight things and all that, this paper is not going to write is, am, are, the, comma, full stop. It's going to point blank ask you about Samter's stride, Trotter's stride, and Gradenigo syndrome and all that. So critical data should be taken time to revise. But if you revise slow, you only revise 60% of what you planned for the day. You must be delivering what you planned for the day. If you're like my agenda, Dr. Dhawan, what will be your agenda tomorrow? Okay, you are appearing in FMG exam and you are not properly prepared. You have a lot of fear of few subjects and some subject you could not revise properly. You're comfortable 10, 12 subject. What will be, Dr. Dhawan, your day tomorrow? Like when I get up, I would be doing in the morning, first of all, I will revise CNS from medicine in 2 hours because my CNS I could not revise after my classes or video lectures. I never touched them. So 2 hours I will be targeting not the first page of CNS. I will go to Parkinsonism, I'll go to epilepsy, I'll go to stroke, I'll go to Guillain-Barré syndrome, I'll go to Alzheimer's and multiple sclerosis. I will try to do these 7 topics in the morning itself so that I know now at least I have done the major chunk of revision of the CNS notes in these 2 hours. If by chance something is left, I'll do tomorrow. First 2 hours, I reduced one fear factor from my life of CNS, at least 6-7 topics. Guillain-Barré syndrome, it's going to be important this time. It was very prevalent in Maharashtra. So you know that why to skip Guillain-Barré syndrome, why to skip multiple sclerosis? Because just your lethargy is not letting you do that. But exam would be cruel. Exam would be cruel. It will assess you in CNS also. Parkinsonism, nobody should become a doctor without knowing basics of Parkinsonism. Nobody should become a doctor, licensed doctor, without knowing the basics of treatment of epilepsy. You should be knowing the drug of choice in the first trimester for epileptic fit in a female. You should be knowing as a doctor. You can't run away from that just because you're scared of that. That doesn't mean there's a grace marks for that. You have to face your fears end on. In the morning, 2 hour, I will do CNS. After that, I will take some breakfast and some tea, coffee, and sit down. And I will now study for 4 hours with 30-minute break in between. I will be doing now my revision of microbiology because microbiology I've done one time. I think I'm okay with that. I can do bacteriology and I can do the in this 4 hour I can revise a lot of bacteriology. Not complete. Nobody can do fully actually. It's not time to remember every word over there. Remember main points about whatever is written over there. Okay. Now I'll take a lunch break of 1.5 hour. I'll take rest, some doze off, some take rest. After 1.5 hour, now I will study the orthopedics. Now I'll diversify my day like that. Orthopedics, I will do how? I'll do like mostly I'll do the first of all tumors because last time I also did fracture. By the time tumors come in orthopedics, I get slow, I get bored. I will do now tumors in the evening actually. And 2 hours plus 2 hour. So guys, please see morning 2 hour for CNS. Then every session is 2 hour, 2 hour. Then two session of 2 hour, 2 hour is for my microbiology, bacteriology. After lunch, 2 hour, 2 hour, two session of 4 hour for orthopedic tumors only. Except fracture, I revise everything. Now after dinner of break of 1.5 hour, in that dinner break, I'll see the social media like Telegram. FOMO is suffering, making us suffer a lot. And after dinner break, I'll be doing 50 plus 50, at least 100 questions from the general surgery, which I did, or something like CNS, because I've done in the morning. I already am fresh. There's no gain over knowledge. But I think general surgery I did, or maybe GIT from surgery I did 1 week back. Today I'll do just 100 question of GIT from surgery only. Then, like that we discussed, we'll discuss those 100 topics from GIT notes of my surgery. Guys, ask yourself and write in the chat box. If in the morning you decrease your fear of CNS, 6, 7 topics. After that, you revise bacteriology from microbiology in 4 hours. Then you took a lunch break of 1.5 hour. And after that, you revised cold orthopedics, not fractures, bone tumors of orthopedics in 4 hours. Then in the night, you did 100 question of, GIT surgery, and you revised those 100 topics from your surgery notes. Guys, if you live 7 days like this, बिलीव मी, तुम्हारे अंदर से फीलिंग आएगी ये वाली, होना नहीं होना ऊपर वाले के हाथ में, मैं पूरी कोशिश कर रहा हूं. होना नहीं होना ऊपर वाले के हाथ में, मैं अपनी तरफ से ईमानदारी से कोशिश कर रहा हूं. मैं पूरा तो नहीं जानता हूं, लेकिन जितना भी जानता हूं उसको रिवाइज करने की कोशिश कर रहा हूं. और लेट मी टेल यू, इस पेपर को पास करने के लिए पूरा जानने की जरूरत भी नहीं होती है. It's not that they want to judge you on the rarest of the rare disorders. They want you to be thorough about basic things, like you should be knowing a lot of the basic stuff which you already know. Every paper has got 100 straightforward questions, believe me. 150 questions are a little tricky from same topics, done in a different way. I'll be doing one more session on Instagram or on YouTube only or somewhere, that how to approach the paper also. We'll do that separately. But this is not time to talk about that actually. But the scheme of the paper in last 26 examinations, it's very clear in my head when I say that with a lot of, with clarity and honesty, this paper wants you to pass the paper. We are doing too many silly mistakes. We are changing lot many answers in second review. We are not decreasing our fears actually. Medicine, ECG is still my fear. Medicine, cardiomyopathy is still my fear. Your CNS, multiple sclerosis, my fear. CNS, the rheumatology, SLE, I've not done till now. Guys, you tell me, if our gaps are still gaps, how will you cross over the 150 side? Do you think magic can happen? Not at all. I'm a very realistic person and I cannot really give this hope, we will be doing it, it can happen. That's not my style of working. My style is actually, I'm more practically oriented. What is possible? My dear friends, with all our honesty and with our own wishes, each faculty member, wants you to pass the examination. All the first timers also, and all those people who message me, I could not pass Rajiv in the last 3 times, 4 times, 5 times. It actually gives pain in the heart actually. And somewhere I want to convey through this YouTube session that guys, if our weaknesses start reducing, if our weak areas in different subjects start reducing, if we start doing multiple choice questions beyond PYQs, if we expand our horizon much wider, guys, you are very close to passing paper. There's something which is still having lacuna over there. It's a time to leave everything. Leave everything. Don't be answerable to anyone. Don't really cater to anybody's whims and fancies. अपने काम से काम रखो. पढ़ाई का time है. This is a time to study for your own self. It's a time to be little self-focused. And people who don't love themselves can't love anyone. It's a time to devote wholeheartedly for your own self. Do not leave, your locations now and go to another location to study there and here. If you have to study, you'll study here only. Guys, it's not a time to really, waste and really, like something is not working out in my life. Maybe financials are not good. Some parental issue, some relationship issue may be there. Some boyfriend, girlfriend issue may be there. Everything is secondary right now, my dear friends. Please understand this. And till 15 July, draw a line in your mind. You have to revise the major point of the notes 2 more times actually. You have to do 100 questions every day minimum. You do at least 4 to 5 grand tests in these days before examination. From 16 July to 25th July, please don't touch those 9 days. I'll be putting one Insta video also. I'll share that on the Telegram also. And I'll share a schedule how to spend those 9 days. Please don't touch that. If you're not following any particular institute or anything, if you're reading on your own, if you're preparing on your own, I'll be sharing a schedule for myself. If I'm a FMG aspirant, how would I revise my content in the 16th July to 25th July frame? And till that time, why can't we do that? Tell me why would you say that we need motivation for that? That's not really, like that. Please understand that you guys know what is right, what is wrong. Only thing is, the problem is that we start anticipating a bad result, and in that anticipation, we start wasting time. And when you waste one day, then next day you waste out of guilt. Look at me, everybody. बताओ चैट बॉक्स में, ऐसा नहीं होता क्या? एक दिन हम लो फील करते हैं, डर लग रहा है दोबारा ऐसा ना हो जाए, पहली बार कर रहा हूँ, पता नहीं पेपर कैसा आएगा, जुलाई पेपर टफ आता है यार, पता नहीं कैसा होगा, अगर मैं पास नहीं हुआ तो क्या होगा, या पता नहीं डर लग रहा है, मेडिसिन पूरी नहीं करी, फार्मा छूट गई है, माइक्रो में ये रहता है. दिस करते करते एक दिन पूरा शाम को हमने बर्बाद कर दिया सोचते हुए, एंड देन यू टेक द शीट एंड स्लीप, एंड कि नहीं पता नहीं डर लग रहा है. नेक्स्ट डे यू स्टार्ट फीलिंग गिल्ट. प्लीज अंडरस्टैंड. नेक्स्ट डे गिल्टी फील होता है और एक दिन और वेस्ट हो जाता है. फिर जब 3-4 दिन वेस्ट हो जाते हैं तो लगता है यार कैसे होगा. let bygones be bygones. Look at me, everybody. Let us do one thing right now. Forgive yourself for the time you wasted till now. Let us invest wholeheartedly in the remaining days. And believe me when I say that, the game is still in your hands. The game is still in your hands. Just look at the day I said. If you study 11-12 hours every day, if you do 100 questions every day, if you do grand test 4 to 5 in the remaining time, I think तुम्हें किसी की जरूरत नहीं है बोलने की, मोटिवेशन की, कि भाई तुम्हें लगेगा अंदर से कि यार पास होने का बहुत चांस है यार, है ना. Now in these days till 15 July, when you read surgery or medicine or gynae or pharmacology, now what you do is look at the pharma notes, and some pages of the pharma notes will be all page important. Put a center star on the top of the page, put a star over there. Now flip over the few pages. Now some page of pharma comes over there. One adverse reaction of a drug is given, which is important. Whole page. Only drug interaction is important out of that whole page. Now what you do, on the left side of that, put a bracket and put a star. I repeat, we will be picking out 300 pages of pharmacology cannot be revised in the last 9 days. What to revise in last 9 days, we'll decide now. How? Out of 300 pages of pharmacology, what you do is you just mark some pages as star pages when the whole page is worth revising, and out of one page, only 3 lines are important of drug interaction. Put on the left side the star. So these are star pages and star islands. Now these 300 pages suddenly become 60 to 65 pages, which are worth revising in the last one spell from 16 July to 25th July. But these star pages and star islands, you have to decide now. Now, burn formula is important. Burn formula is important. You know it actually. It's important. Placenta previa, placenta abruptio, monozygotic, dizygotic twins. You might forget it. So why not put a star over there, bracket around that, and that page is important, or that thing is important. And in the last, okay, ask yourself, if you were sitting over here and I'm sitting over there, and realistically evaluate it actually. If you are committed for passing the examination, why would you waste single day? Tell me. अगर मैं तुम्हारी जगह होता ना बच्चे, मैं सही बता रहा हूं तुम्हें, अगर मैं तुम्हारी जगह होता तो मुझे किसी की जरूरत नहीं होती बोलने की, मैं चुपचाप पढ़ रहा होता. अगर ये 50 दिन मेरे पिछले 5 साल को कोई मतलब देके जाने वाले हैं, तो मैं टिक के पढ़ाई करता. मैं दोबारा बोल रहा हूं, अगर ये 50 दिन मेरे पिछले 5 साल को कोई मायने देके जाने वाले हैं, तो मैं टिक के पढ़ाई करता. मैं बोलता अपने आप को कि होना नहीं होना ऊपर वाले के हाथ में, मैं अपनी तरफ से पूरी कोशिश करूंगा. और क्यों नहीं करनी चाहिए? मतलब इसमें क्या मोटिवेशन चाहिए भाई, मुझे ये बताओ. इसमें डू यू थिंक दिस नीड्स मोटिवेशन? एक्चुअली you are much way smarter than anybody knows you. I know you guys. You're very smart people, very intelligent people. Only thing is energy needs to be channelized, and you should not be dependent on anybody else's motivation. डर कहां लग रहा है? डर क्या लग रहा है? अगर पास नहीं हुए तो. मेरा सवाल यह है कि अगर मेहनत करी और पास हो गए तो. डर तो ये लग रहा है ना, अगर पास ना हुए तो. उस डर में हम पढ़ाई कम कर देते हैं. मेरा क्वेश्चन ये है कि अगर मन से पढ़े और अगर पास हो गए तो. That's not possible. 150 out of 300 without negative marking. Why it's not that possible, बच्चे? This is possible. मैं फिर कह रहा हूं तुम्हें, मैंने आज 21 years हो गए करते हुए यही सब काम. मैंने कभी भी वो चीज नहीं बोली जो पॉसिबल ना हो. If somebody comes from NEET PG side and says, if I start studying today, it is possible to crack a good rank. It's not possible. NEET PG is a different exam, बच्चे. It's a different exam. You guys have a different exam. It's a threshold passing examination. They ask common things, but we are doing too many silly mistakes because we don't practice the art of solving multiple choice questions. Now, the last thing before I leave you, I won't take much of your time. Guys, we are together. We're together. A lot of people are working together, like these fellows, bright medical makers. Every faculty, every institute, every app, people would want their students to pass the examination. But nobody can give paper on your behalf. You are the one who has to execute it. If you hear me all this, and if you just keep on doing the same wrong things which you're doing earlier, then what was the fun of attending this YouTube live also? मजा तब है इसमें सुन के अपने आप को 10-15 मिनट कमरे में अकेले बैठ जाओ, जॉट आउट द प्लान, मैं क्या करने वाला हूं भाई. और नींद सबको आती है, सुस्ती सबको पड़ती है, नेगेटिव सबको फील होता है, लेकिन समझदार इंसान वो होता है जो बोले कि नहीं मुझे पढ़ना है. एक जिद होनी चाहिए कि पढ़ना है भाई. नींद के सामने सरेंडर करके थोड़ी सो जाना है मेरे को. यू हैव टू फोर्स योरसेल्फ स्टडी. मैं हमेशा बोलता हूँ, क्लास में बोलता रहता हूँ, पढ़ाई मन से होती नहीं है, पढ़ाई मन मार के होती है. पढ़ाई कभी मन से नहीं होती है. मन करेगा पढ़ने का तो ऐसा तो कभी दिन आएगा. मेरा तो कभी दिन आया ही नहीं. पढ़ाई का मन कर रहा है, पढ़ाई का मन नहीं करता. किसका मन करता है पढ़ाई का? पढ़ाई मन मार के होगी बच्चे. और ये टाइम आ गया है जब अपने आप और स्ट्रिक्ट होना है. Fine. So let me recapitulate one time before I say, goodbye on this YouTube live. Number one is you should be more dedicated. Number two is every day you should be studying close to 12 hours or more than 12 hours per day. Number three, don't do one subject in one day. You should be doing diversified approach for the subject. 2 to 3 subjects you can do. Number four, you should be doing 100 questions, 100 to 150 questions every day, but do that in the block of 50-50 and review all those 50 question after you attempt the question from your notes preferably, and if the question is not in your notes, then you can see the app explanations also. And 4 to 5 GTs should be done in the remaining days, and keep reminding yourself, हम पास होने के बहुत ही पास है. ये पेपर पास किया जा सकता है. ये पेपर बना ही ऐसे है कि पास करना वाला है. लास्ट टाइम पास नहीं हुआ. ऑल द रिपीटर्स hear me carefully. We will try our level best to not do the same mistakes this time. Who is a good repeater who does not repeat the same mistakes? There are some areas where we're still weak at, and if first 2 hours every day we devote to those weaker areas only, and if we do question beyond PYQs every day, believe me, your brain will start getting sharpened over there. I'll be certainly doing few more sessions in the coming days about approach on the exam day, and how to score maximum out of the simple questions, how to score the best out of the tricky question also, to talk about them also, the question oriented strategy, the exam oriented strategy. But it's one of the first series of those kind of lives we do in the last 6 weeks. So this was one of them. But I hope everybody goes back from here with a hope. I hope that everybody goes back from this YouTube live with a hope to pass examination. Tell it to yourself कि perfect कोई नहीं होता, पूरा किसी को नहीं आता होता, लेकिन if I devote myself fully in these 45 days, I'll be reaching very close to passing the paper. मैं पास होने के बहुत पास पहुंच जाऊंगा. बाकी we will see on that day what happens. And with the blessing of parents and Almighty, we can really, like really do really better things. I'm telling you. Guys, there will be health problem. People will be having. Karishma, get a good treatment and take a proper opinion and get the treatment done. Anybody any question? Guys, please go back from this YouTube live with a hope. मैं तुम्हें बता रहा हूँ, हमेशा डर लगेगा फर्स्ट टाइमर्स को भी और रिपीटर्स को भी, लेकिन let us create a genuine hope within us that with our hard work, with the blessing of parents and Almighty, will pass the exam. Always pray like this: may my hard work be blessed. May my friends also pass the exam. May also pass the exam, like that. Okay. GT score are not the determinant of the final outcome on the exam day. GT, please use the GT for assistive as an assistive tool. Don't use that as assessment tool. It's not assessment tool. It's just to assist you, to train you for the exam day. Still the time you'll keep doing 100. If you're scoring 100 out of GT now, I'm telling you, then there is a lot of deficiency in your preparation in multiple subjects. Okay, we're fine. Satish, you have to look at this one. If your GT score is 100 or below 100, it means that you have to have a lot of knowledge still to be acquired in a lot of subject. Only thing is, we do a GT and we say that kharab ja raha. Aisa nahi hota bhai. You have to look at what are the 5 weakest subject out of that GT. 135, like Aman said, this is really 130 to 180 is going okay. Aman said everybody 135, 140, 145. Who's scoring in that zone actually? Please look at your 5 weakest subjects. Choose them for first 2 hours of the day. Again, I say through the grand test or without the grand test. You choose your 5 weakest subject or 5 weakest part of the subjects. You devote first 2 hours every day for those weakest subjects or weakest topic of the subjects only. Revision would not be Shreya will say revision will never be enough. Don't worry. It's an objective paper. Look at me, everybody. Look at me, everybody. If I randomly ask you a question, all of you look at me. If I randomly ask you a question, a patient underwent adenotonsillectomy, and in the evening, the patient is crying with the neck spasm, neck pain, and torticollis. What is the namal syndrome? Maybe the syndrome does not come to your name, but I say, like, which of the following is the correct diagnosis of this above condition? Neck spasm after surgery. Grisel syndrome, Kalman syndrome, Hartmann syndrome, or Gutsman syndrome. Your brain will say, no, I think it was Grisel syndrome, Grisel syndrome. Now, when you look at Grisel syndrome word, then you will be, oh yeah, it's Grisel syndrome. Don't you think so? It's objective paper. So revision is sufficient if you are able to see the data 2 more times before 15th July. In the last 9 days, we revised the content, at least main star island, star points, star pages, 1 more time in the last 9 days. देख के याद आ जाएगा. अभी क्या हो रहा है? देख आंखें बंद करके याद नहीं आता, हम घबरा जाते हैं. When we close our eyes, we don't remember something, we get scared. Now, if you look at that, for example, which of the following is the best method of adenodectomy? Adenodectomy, best method. Now, you may not remember the word best method of adenodectomy, but choices are, curettage, microdebrider, suction diathermy. Your brain will tickle you. Oh, it's coblation. It's coblation. Yeah, it's coblation, like that. That's how we really do that. Do not spread negativity. I'm honestly telling you, if you keep telling yourself, I'm forgetting, you will forget it. That brain is like that. You tell it yourself, मुझे देख के याद आ जाएगा. सब पूरा याद नहीं आएगा, 60-70% data देख के याद आ जाएगा. Guys, know the paper to crack the paper. The paper is, the things are written over there, 1, 2, 3, 4. You have to just tell, what is the name of maneuver used for puberphonia? The name of maneuver, Hartmann, Gutsman, Valsalva Muller. Oh yeah, Gutsman. Oh man, have guts, speak like a man. Gutsman maneuver is for puberphonia. Shreya Verse, I hope I've given the answer to you. Revision are enough. Revision are enough. But only thing is, you won't be able to recall 100% of the exam day. I will not make a lie over there. I'll not make a lie over there. 60-70% data you'll be able to recall if you are ready to walk the path as I'm saying. Tell me in the chat box and commit to me that you would be doing utmost hard work in the remaining 45 days. Please commit to me, commit to yourself that you'll be doing utmost hard work. You'll be solving questions beyond PYQ, 100 to 150 question every day. You know what? We have to do that. And everybody tell it to yourself, you know what? हम पास होने के बहुत पास हैं यार, बहुत ही पास हैं. Honestly, I'm telling you, I'm not making a story over here. I'm not faking it up actually. हम पास होने के बहुत ही पास हैं. डर सबको लगता है. डॉक्टर धवन, अगर आपका पेपर होता तो आपको डर नहीं लगता? बहुत डर लगता भाई. सच्ची बता रहा हूँ. श्रेया से everybody who was saying that Radhika, Jolly Joseph, मेरे को भी डर. Everybody, I would have been scared. But being scared does not mean that we spoil the whole time. बच्चे. We have to control our behavior. Okay, Chauhan, Krishma Chauhan, already there are many revisions of ENT. You just type one ENT revision on the YouTube, you'll find many latest sessions also. Okay, fine. When to do MCQs, morning, evening, beta. For me, it's always night time for MCQs. You decide. Whenever you feel it is slow, do the MCQs in that time. For me, it's always 9:30 to 1 a.m. 9:30 p.m. to 1 a.m. will be my time. And one more important thing, sleep at one time, get up at one time. Sleep at one time, get up at one time. The best time to sleep for the late riser will be 1 a.m. to 6 a.m. or 1 a.m. to 6:30 a.m. Please stick to one sleep schedule. You can't change your sleep habit in the last 1 week. Okay. So sleep at one time and get up at one time. My sleep is 1 a.m. to 6:30 a.m. And I think you can also adopt that. If you're early riser, you can sleep 11 o'clock also, but get up in the morning. There's dog of family problems, financial problem, and friendship problem. 3F, forget the 3F right now. Family problem, financial problem, and the friendship problem. These relationship issues and all. Put that to back burner. If we clear the exam, we will be able to face these problems with much more strength. If we pass the exam, we'll be able to these family problem, financial problem, and the relationship issues much more strongly. And I think you're wise enough. Prioritizing is very, very important. Right now, my priority, nobody's 100% settled with her. Nobody. Absolutely, you know that. Like Dr. Dhawan, do you have any problem in your life? Is like that. Life is dynamic, Vijay. Life is dynamic. Okay, go. I hope you really have to, tell it to yourself. Everything is secondary. Whatever family problem you're encountering, let me tell you one thing. You may be thinking that you are uniquely suffering from that, but everyone has a story. If you dissect them, you'll find a story over there, a reason to feel unsettled. But who are the wise people? Prioritize the exam first of all. Prioritize exam. If you don't complete the subject like Optha, Pharma, Biochemistry, Mohammad Farhan, please keep first 2 hours for the subject till 25th June. Keep learning something additional till 25th June. Farhan, I hope I gave them clear answer over there. Till 25th June, you can keep on adding new information. After that, no more new information. Okay, fine. I think Marama gave a very good. If you pass the exam, all your questions will be answered. Okay. Arvind, I know that nothing is retained is because you feel it's subjective paper. When you look at that question from the objective style, you will be able to recall some of the things, not everything. If you revise the content 2 more times till 15 July, and in the last 9 days you revise the star page and star island 1 more time, believe me, you will be able to recall 60-70% of data. I'm not saying 100% of data, but right now your heart is trembling like this. I'm forgetting this, I'm forgetting that. Believe me, within this feeling of incompleteness lies the perfect path to pass the examination. I know everybody's heart is trembling like this, that I'm not perfect, my subject is weaker. Within this feeling of imperfect preparation lies the perfect path to pass the examination, provided you spend this second half of preparation properly. Guys, निखिल सेकंड अटेम्प्ट है, आपने पहले पढ़ा हुआ है, go more aggressive on the MCQ side. Actually, I would say go more MCQ oriented, and people who are repeating, you must be doing NEET PG question at least of last three sessions. You should be doing NEET PG question. Last three session, 3 years, maybe 3 years. There were two paper in one go. At least last 3 years, question of NEET PG should be done if you're a repeater. If you're a repeater for sure. Okay, fine. Thank you very much, guys. I would not take much of your time, and uh, please leave the session with the hope to pass exam. That's the most important thing. Realistic hope, not motivated kind of thing. That's none of our business. Just spend all the days properly, extract the best out of the whole thing, and every day. And let's really create that genuine approach that I'm doing my level best. Let's see what happens actually. There are already a lot of MCQ discussion on the YouTube. You know it. Just type ENT PYQs with my name. You'll find over there. Okay. Last time we got 130. What should I do now? You should study, Deepika. If you're thinking a miracle will happen, miracle will not happen. If you think somebody else will come and really appear on your behalf, nobody will appear on your behalf. If you think your weaknesses will remain weaknesses till you'll pass the exam, it will not happen. I'm sorry for being very direct, Deepika, because I want you to pass the examination. Deepika, you understand? You're feeling lethargic, you're feeling negative. Everybody feel lethargic and negative. That's not the solution. You have to pep up yourself actually. पढ़ने का मन कभी नहीं करता, पढ़ाई का मन मार के होता है. Guys, इस तरह बैठे रहना कि पता नहीं क्या होगा, इस बार भी ऐसा हो गया तो then really work actually. Okay, fine. Everybody, you got last time 130, 149. Believe me, by correcting two things. Number one, make weaker subjects relatively okay. Number two, do more questions and GTs. Believe me, you will be very much on the other side of 150 with the grace of God actually. But we'll discuss about it to decrease the silly mistakes. We'll discuss another session about the exam. I'll be posting on the Telegram and the WhatsApp group also about it. And Deepika, through you, I want to tell everyone who's repeating, please understand that negativity, डर लगना, दोबारा फेल हो जाने का डर लगना, this is natural, but that's not the solution. That's the, in fact, time wasting strategy of the brain. It actually pulls you down. Then you waste 3-4 days or 3-4 weeks. Then you are totally down actually. Let's come out of that phase and let's chart out a plan and deliver the plan also every day. We make the timetable, we don't fulfill the timetable, then we feel negative. It's a time to now deliver whatever timetable you make and make sure you're studying 11-12 hours every day. Okay, fine. So I'll take your leave now. Thank you very much. I have another session for NEET PG people at 10 p.m. But it's always a pleasure to interact with you, to be part of your journey. And please pray every night. May my hard work be blessed actually. Do a lot of hard work. फिर दोबारा बोलो अपने आप को, भाई होना नहीं होना ऊपर वाले के हाथ में. मैं पूरी ट्राई कर रहा हूँ. मैं पूरा ट्राई कर रहा हूँ. होना नहीं होना ऊपर वाले के हाथ में. हाथ जोड़ के बोलना होता है. Please bless my hard work. May my friends also pass. May also pass the examination. It's a way to keep your mind, like little sane and sorted. Okay. Thank you, everyone. Thank you very much. I'll take your leave. I'll end the stream over here. Thanks a lot. We'll pass. We'll certainly, with the blessing of parents, we'll pass exam, provided you do a lot of hard work. And I'm sure you will do hard work. Thank you very much.